Hepatopulmonary syndrome. Definition. Hepatopulmonary syndrome is the most common cause of respiratory insufficiency in patients with chronic liver disease. It is characterized by a gas exchange abnormality caused by intrapulmonary vascular dilatation in patients with liver disease.
Hi, this is medical prescription Alex. Let's talk about hepatopulmonary syndrome. In the previous video, we have talked about the triad of the hepatopulmonary syndrome. Now let's get more details and more pathophysiology. So, hepatopulmonary. A problem in the liver will lead to a problem
Application in nursing. Clinical characteristics of patients with HPS are mainly consequences of hypoxemia. They later symptoms like cyanosis and digital clouding, furthermore painful, and orthoxia are observed in up to 25% of the patients with HPS. However, clinicians should be aware to pulmonary comorbidity can cause it in HPS, in particular chronic obstructive pulmonary disease, bronchial asthma, idiopathic pulmonary fibrosis, and restriction of the lung. Following stroke pulmonary complications like assistant or hepatic hydrothorax can contribute to a great dyspepsia. Pros and cons. As our understanding of the cause of HPS evolves, in the more and more evidence that this no median change in pulmonary blood vessel size likely result in a more chronic change in the structure of the blood vessels themselves, which is called vascular remodeling. In Su apply network. Lung perfusion scanning determines the extrapulmonary transaccumulation, but it's not able to discuss between intracardiac and intrapulmonary shorting. It is mainly used to discuss in the degree of hypoxia caused by intrapulmonary vasodilation versus other potential contributing factor like no-vascular pulmonary or extrapulmonary factor. Lung imaging techniques like chest X-ray or thoracic computer tomography are used for excluding other coexist chronic respiratory condition. Conclusion. Current knowledge about HPS is limited and is essentially based on a study of chaotic patients listened for LT or animal experiment. This study have enabled us to establish the fact that HPS is a frequent complication for these patients, and although it's generally asymptomatic, it does have an impact on their quality of life and survival. It has also been established that LT is an efficient method of treating the syndrome and has positive post-transplantation survival results.